I'm Dr. Prem Subramanian. I am a professor of ophthalmology and neuro-ophthalmologist at the University of Colorado School of Medicine. And in that capacity, I take care of a number of patients with thyroid eye disease, both those who are in need of medical therapy, as well as those who may benefit from surgery for their treatment. And I have been involved in clinical trials for treatments of thyroid eye disease and have done research on the disease for most of my career. There's an autoimmune disease that, for the most part, happens in people who also have systemic Graves' disease. So they have hyperthyroidism caused by an autoimmune process where the body attacks the thyroid gland and then too much thyroid hormone is produced. And in about 50% of those patients, that same autoimmune process will attack the tissues of the orbit, and in particular cause the fat that normally is in our orbits to expand, cause the muscles that move our eye to become more fibrotic and to become stiffer and enlarged as well. And so the combination of those processes will lead to a prominence of the eyes. It can lead to restriction of eye movement and double vision. It can lead to exposure of the eye, and it can even lead to vision loss in extreme cases. There are some people who develop thyroid eye disease without any sort of systemic thyroid disease, but that is a less common reason or less common clinical condition. Once a patient is diagnosed with thyroid eye disease, if they don't already have a diagnosis of systemic thyroid disease, then an investigation is done to see if they do have a systemic thyroid imbalance. And then it is a collaborative relationship between an often endocrinologist and an ophthalmologist taking care of a patient to help make sure that their systemic thyroid status is under good control, and then also to address any of the eye symptoms that they have through a variety of medical or surgical interventions based on how severe their symptoms are and what is happening in terms of whether their disease is changing or not. The data that were presented, they came from 3 trials that were conducted previously. And so it's really a long-term analysis of the data from 3 clinical studies, the phase 2 and phase 3 clinical trials that were conducted to evaluate the efficacy of teprotumumab for the treatment of thyroid eye disease, and then the follow-on OPTIC-X study in which subjects in those trials, in the phase 3 trial, who did not respond to the initial treatment, which was a masked treatment, they were given open label teprotumumab at that point in time. And so those 3 cohorts of patients were followed out for at least 72 weeks to see what changes or what improvement in their thyroid eye disease was observed after their treatment in these studies. At a high level, what it showed was that the majority of patients experienced a long-term improvement, so saying out to at least 72 weeks and potentially longer in a smaller cohort of individuals followed out to 120 weeks, that the majority of them experienced a continued relief from symptoms of thyroid eye disease like redness, pain, pressure, and also objective improvement in their disease as measured by a reduction in proptosis, the prominence of their eyes. Those individuals who had an improvement in their quality of life as measured by a standardized quality of life score, the majority of them maintained that improvement through this follow-up period, and that it was a small number of patients who needed to undergo a surgical procedure like an orbital decompression in order to address any ongoing manifestations of their thyroid eye disease. Studies, I think, show us, at least in the population that was selected to be in the clinical trials, that treatment with teprotumumab seemed to induce a significant and persistent improvement in the signs and symptoms of thyroid eye disease in this population. So I think that's important for two reasons. One is that this population doesn't represent everyone with thyroid eye disease. It represents a population of people who had had the disease for a relatively short duration before they were treated with teprotumumab. But in that regard, though, it's encouraging that the majority of them maintained an effect from this 6-month treatment with drug, even when you looked at them a year or more after that treatment had concluded. The data from this paper looking at clinical trials is really important. It's also important that we continue to collect real-world data on patients who don't quite fit the clinical trial criteria, but who also have been treated with teprotumumab to see if they get the same benefit, better benefit, or not as much benefit from being treated with the drug, because as physicians taking care of our patients, it's really important that we have all of that information to best guide what we do for them.